Sleep through the night. 5 exercises to stop frequent bathroom trips. If you're over 55 and you're waking up 2, 3, maybe even 4 times every night to use the bathroom, I need you to stay with me for the next few minutes. Because what I'm about to share with you has helped hundreds of my patients sleep through the night again. Or, at least, cut those bathroom trips in half. And the surprising part? It has nothing to do with drinking less water before bed. I've been working with seniors for over 2 decades now, and I can tell you that frequent nighttime urination, what we call nocturia in medical terms, isn't just about your bladder. There's actually a connection between your circulation, your pelvic floor, and yes, even your blood pressure, that most people never learn about. And there's a simple set of exercises, takes about 5 minutes before bed, that research suggests may help support better bladder control naturally. Now, I know you might be thinking, another YouTube video promising miracles. I get it. But I'm not here to sell you anything or make wild promises. I'm here to share what I've seen work in real patients, real seniors just like you, who were desperate for a full night's sleep. Before we go any further, let me be very clear about something. This video is for educational purposes only. I'm not diagnosing you, I'm not treating you, and I'm absolutely not telling you to stop any medications your doctor has prescribed. Frequent nighttime urination can be caused by many different things, from enlarged prostate in men to urinary tract issues, diabetes, heart problems, or medication side effects. So everything we discuss today should be done alongside your regular medical care, not instead of it. If you're experiencing this problem, please talk to your doctor first to rule out anything serious. What I'm sharing today are supportive habits that research suggests may help, but they're not a replacement for proper medical evaluation and treatment. Now, let me tell you a bit about where I'm coming from. I spent more than 20 years in clinical practice, and a good portion of that time has been working specifically with patients in their 60s, 70s, and beyond. And I've noticed patterns. I've seen what works and what doesn't when it comes to quality of life issues that often get dismissed or just managed with another pill. Frequent nighttime bathroom trips is one of those issues that profoundly affects your life. It disrupts your sleep, leaves you exhausted during the day, affects your mood, your energy, even your confidence about traveling or staying overnight anywhere. But in a typical 10-minute doctor's appointment, there's often only time to prescribe a medication or say, "That's just part of getting older." I'm not criticizing doctors, I'm one of them. But I am saying there's more to the story. Here's what most people don't understand. Your bladder doesn't just suddenly become weak or overactive for no reason. Yes, aging plays a role, but there's usually an underlying mechanism that's driving the problem. Think of your body like a house with plumbing. If water keeps backing up in your sink, you don't just keep mopping the floor. You look at the pipes, right? You check for blockages, poor water pressure, or structural issues. With frequent nighttime urination, your bladder is often just responding to signals it's getting from other parts of your body. And one of the biggest factors, especially as we age, is circulation and fluid redistribution. During the day when you're upright and moving around, gravity pulls fluid down into your legs and feet. You might notice some swelling by evening. That's normal to some degree. But here's the key. When you lie down at night, all that fluid that's been sitting in your lower body starts to get reabsorbed into your bloodstream. Your kidneys then filter it and send it to your bladder. That's why you wake up needing to go. Now add to that picture something else that happens as we age. Our blood vessels become stiffer, our heart may not pump quite as efficiently, and certain hormones that regulate fluid balance change. All of this can make that nighttime fluid shift even more dramatic. And here's where it connects to blood pressure. Many seniors are on blood pressure medications, including diuretics or water pills. Those are often taken in the evening, which pushes even more fluid through your system at night. Let me tell you about Margaret. She came to see me about 3 years ago, frustrated and exhausted. She was 68, had been waking up 4 times a night for almost 2 years. She'd tried everything her doctor suggested, cutting out caffeine, limiting fluids after dinner, setting alarms to go before bed. Nothing worked. She was on medication for high blood pressure and had been told her bladder was just overactive and age-related. She'd even been prescribed bladder medication, but it made her mouth so dry and didn't really solve the problem. Margaret told me she was afraid to visit her grandchildren overnight. She was embarrassed. She felt old and broken, and she was so tired during the day that she'd stopped doing activities she loved, like her gardening club and weekly bridge games. As we talked, I asked her about her circulation, about swelling in her legs, about her exercise routine. She admitted she'd become more sedentary over the past few years, partly because of knee pain, and yes, her ankles were quite swollen by evening. That's when I realized Margaret's problem wasn't primarily her bladder. It was her circulation and pelvic floor strength. Her body was pooling fluid during the day because her circulation was sluggish, and then dumping it all back into her system at night. And her pelvic floor muscles, which help support bladder control, had weakened from years of inactivity. Let me explain what's happening inside your body in simple terms. Your pelvic floor is basically a hammock of muscles at the bottom of your pelvis. These muscles support your bladder, your bowels, and in women, the uterus. They're involved in everything from bladder control to core stability. When these muscles are strong and responsive, they help your bladder hold more urine comfortably and give you better control over when you need to go. When they're weak or tight or uncoordinated, you get urgency, frequency, and those nighttime interruptions. Now, combine weak pelvic floor muscles with poor circulation. When blood flow to your lower body is sluggish, you get fluid retention and swelling during the day. At night, when you elevate your legs by lying down, that fluid gets mobilized. Your heart and kidneys work to filter it, and your bladder fills up repeatedly. Add to this picture the fact that, as we age, our blood vessels lose some of their flexibility. They don't expand and contract as well as they used to. This makes it harder for your body to regulate blood pressure and fluid balance smoothly. Many seniors are also dealing with some degree of heart function decline. Nothing dramatic, not heart failure necessarily, but just less efficient pumping. This too can contribute to daytime fluid retention that reverses at night. And finally, there's a hormone called ANP, atrial natriuretic peptide, that your heart releases when it senses increased blood volume. At night, when all that leg fluid comes back into circulation, your heart releases more AMP, which tells your kidneys to make more urine. It's your body trying to balance things out, but the result is you're up every few hours. Now, why doesn't your doctor tell you all this? It's not because they don't care. It's because in a typical appointment, there's barely time to review your medications, check your blood pressure, and address your main complaint. There's certainly no time to teach you exercises or discuss detailed lifestyle modifications. The system is set up to prescribe solutions quickly. Overactive bladder? Here's a medication. High blood pressure? Here's another medication. Swollen ankles? Let's add a diuretic. And medications absolutely have their place. I'm not anti-medication at all, but medication works best when it's combined with lifestyle support that addresses the root causes. And that's what often gets missed. The good news is, you don't need to wait for the medical system to catch up. You can start supporting your body right now with simple, research-backed exercises. I want you to know something important. It's not too late. I don't care if you're 55 or 85. Your body still responds to consistent, gentle input. Your muscles can still get stronger. Your circulation can still improve. Your pelvic floor can still become more coordinated and supportive. I've seen it happen over and over again. Patients who thought they were sentenced to poor sleep for the rest of their lives, who were planning their days around bathroom locations, who'd given up on travel and social activities, getting their lives back. Not overnight, not with some magic pill or miracle cure, but gradually over weeks and months with small, consistent habits that support their body's natural healing capacity. And the beauty of what I'm about to share with you is that it's simple, it's free, it requires no equipment, and you can start tonight before bed. So let's talk about these 5 exercises. Research suggests that pelvic floor exercises combined with movements that support circulation may help reduce nighttime urination frequency in seniors. These exercises work by strengthening the muscles that control your bladder and improving the circulation that affects fluid balance. Exercise number 1, the basic Kegel. Now, you've probably heard of Kegel exercises, but most people don't do them correctly. Here's how they actually work. Sit comfortably in a chair or lie on your back. Imagine you're trying to stop urination midstream, or if that's hard to imagine, think about trying to hold in gas. You should feel a gentle lifting and squeezing sensation in your pelvic floor. Not your buttocks, not your thighs. Just that hammock of muscles deep in your pelvis. Hold that gentle squeeze for 3 to 5 seconds. Don't hold your breath. Just breathe normally. Then release completely and rest for 3 to 5 seconds. Start with 10 repetitions. Do this twice a day, morning and before bed. Now here's the key, quality over quantity. A proper focused Kegel where you're really connecting with those muscles is worth much more than 50 sloppy ones where you're just clenching your whole lower body. Exercise number 2, ankle pumps. This one improves circulation in your legs and helps reduce that daytime fluid pooling we talked about. Sit in a chair or lie in bed. Simply flex your feet up toward your shins, then point your toes away. Up and down, like you're pumping a pedal. Do this 20 times, nice and slow. This gentle pumping action activates your calf muscles, which act like a pump to move blood and fluid back up toward your heart. Research suggests this may help reduce leg swelling and the nighttime fluid shift that fills your bladder. Do this several times during the day, especially if you've been sitting for a while, and definitely before bed. Exercise number 3, supported bridge. This exercise gently strengthens your pelvic floor, lower back, and glutes, while also encouraging better fluid circulation. Lie on your back with your knees bent and feet flat on the floor, about hip-width apart, arms by your sides. Take a breath in, and as you exhale, gently lift your hips off the floor. Just a few inches. You don't need to arch dramatically. At the top of the movement, gently engage your pelvic floor, like you're doing a Kegel while in this bridge position. Hold for 3 to 5 seconds, breathing normally, then lower back down slowly. Start with 5 repetitions and work up to 10. Do this once a day, preferably in the evening. Exercise number 4, gentle leg elevation. This is less of an exercise and more of a position, but it's incredibly helpful. About 1 to 2 hours before bed, elevate your legs. Lie on your couch or bed with your legs propped up on pillows so your feet are above the level of your heart. Stay here for 15 to 20 minutes. This position encourages that daytime fluid in your legs to drain back into circulation while you're still awake. Your kidneys can process it, and you can use the bathroom before bed rather than having all that fluid mobilize once you're lying flat for the night. Research suggests this simple positioning strategy may help reduce nighttime urine volume significantly. Exercise number 5, diaphragmatic breathing with pelvic floor engagement. This one connects your breathing pattern with your pelvic floor, which research suggests can improve coordination and strength. Sit comfortably or lie on your back. Place one hand on your chest and one on your belly. Breathe in slowly through your nose, letting your belly expand like a balloon. As you do this, let your pelvic floor relax and soften. Now breathe out slowly through your mouth, letting your belly fall, and as you exhale, gently engage your pelvic floor, lifting and squeezing gently. The rhythm is inhale, pelvic floor relaxes. Exhale, pelvic floor lifts. Do this for 5 to 10 breaths. It helps coordinate your deep core muscles with your pelvic floor and can be very calming before bed. Now, why do these exercises help? It comes down to 2 main mechanisms. First, strengthening your pelvic floor muscles gives you better bladder control. When these muscles are strong and responsive, your bladder can hold more urine comfortably, and you have better control over the urge to go. Research published in journals of urology and aging has shown that pelvic floor exercises can reduce urinary frequency and urgency in older adults. Second, improving circulation reduces that daytime fluid pooling and nighttime mobilization cycle. When your leg circulation is better, less fluid accumulates during the day, so there's less to process at night. The ankle pumps and leg elevation specifically target this, and the breathing exercise helps tie it all together by improving the coordination between your pelvic floor and your diaphragm. These two work together as part of your deep core system, and when they're coordinated, everything functions better. This isn't magic, it's just basic physiology. But it's physiology that most people never learn about, and it can make a profound difference in your quality of life. Let me come back to Margaret, the patient I mentioned earlier. After we talked about all this, she was skeptical. She said, "I've been dealing with this for 2 years. How are some simple exercises going to fix it?" I told her the same thing I'm telling you. These aren't a quick fix, they're not going to cure you overnight. But if you do them consistently, your body will respond. Margaret started with just the basic Kegels and ankle pumps. That's all. She did them twice a day for 2 weeks. She noticed nothing at first. But then, around week 3, she realized she'd had a couple nights where she only woke up 3 times instead of 4. Small progress, but progress. That encouraged her. She added the bridge exercise and started elevating her legs before bed. By week 6, she was averaging 2 bathroom trips per night. By 3 months, most nights were just 1, sometimes 2. She couldn't believe it. She told me, I feel like I got my life back. Now, Margaret also worked with her doctor. They adjusted the timing of her blood pressure medication to earlier in the day so the diuretic effect wasn't hitting right at bedtime. That helped too. But the exercises were the foundation. They gave her body the strength and circulation support it needed to manage fluids better. Now, these exercises work best when you combine them with a few other supportive habits. You don't have to do all of these, but the more you can incorporate, the better your results may be. First, timing of fluids. Instead of drinking a lot of water right before bed and then trying to restrict it, spread your fluid intake throughout the day. Drink most of your fluids in the morning and early afternoon. Taper off after dinner, but don't cut fluids out entirely. Your body needs hydration. Second, watch caffeine and alcohol. Both can irritate your bladder and act as diuretics. If you're drinking coffee or tea after lunch, or wine with dinner, try cutting back or eliminating these, especially in the evening, and see if it makes a difference. Third, consider compression socks. If you had significant leg swelling during the day, wearing compression socks can help reduce that fluid pooling. Talk to your doctor about the right compression level for you. Fourth, gentle movement throughout the day. You don't need to run marathons. Just walking for 10 or 15 minutes a few times a day can significantly improve your circulation. Even standing up and moving around for a few minutes every hour if you've been sitting can help. Fifth, elevate your legs during the day if you can. If you're watching TV or reading in the afternoon, prop your feet up. It all helps with that circulation and fluid balance. Let me tell you about some common mistakes people make so you can avoid them. Mistake number 1, doing too much too soon. I've had patients get excited and try to do all 5 exercises 3 times a day from day 1. They burn out within a week. Start small, maybe just the Kegels and ankle pumps for the first 2 weeks. Then add another exercise. Slow and steady wins the race. Mistake number 2, expecting instant results. Remember, you didn't develop this problem overnight. Your body needs time to respond. Give it at least 4 to 6 weeks of consistent practice before you judge whether it's working. Mistake number 3, doing the exercises incorrectly. Especially with Kegels, many people engage the wrong muscles. If you're not sure you're doing them right, consider seeing a pelvic floor physical therapist for a session or 2. They can teach you proper technique. Mistake number 4, stopping too soon. Once you start seeing improvement, keep going. These exercises work when they become a regular part of your routine, like brushing your teeth. Before we wrap up, let me give you a few important safety reminders. First, if you have any pain while doing these exercises, stop and consult your doctor. Exercises should feel gentle and manageable, not painful. Second, if you're experiencing sudden changes in urination patterns, blood in your urine, pain with urination, or significant increase in nighttime trips, see your doctor right away. These could be signs of infection, prostate issues, diabetes, or other conditions that need medical attention. Third, never stop or adjust your medications without talking to your doctor. If you are on blood pressure medications, diuretics, or bladder medications, keep taking them as prescribed unless your doctor tells you otherwise. And fourth, monitor your progress. Keep a simple diary for a week or 2. Know how many times you're waking up at night. Then, after you've been doing the exercises for a month, check again. This gives you objective data to share with your doctor and helps you see progress even when it's gradual. All right, so here's what I want you to do tonight. Keep this simple so you actually do it. Before you get into bed, do 3 things. First, sit in a chair or on the edge of your bed and do 10 gentle Kegel exercises. Remember, squeeze like you're stopping urination, hold for 3 to 5 seconds, release completely, rest for 3 to 5 seconds, 10 times. That's it. Second, do 20 ankle pumps. Flex your feet up and down, nice and slow. Get that circulation moving. Third, about an hour or 2 before bed, lie on your couch or bed with your legs elevated on some pillows for 15 to 20 minutes. Let that daytime fluid drain while you're still awake. That's your starting point. Just these 3 things. Tonight, tomorrow night, every night, every night. Then, in a week or 2 when this feels natural, add the bridge exercise. Then later, add the breathing exercise. Build slowly, be consistent, be patient, and give your body the time it needs to respond. I know how frustrating frequent nighttime bathroom trips can be. I've sat with patients who've cried, talking about how exhausted they are, how it's affecting their relationships, their mood, their ability to enjoy life. But I've also sat with patients who've told me with tears of joy that they slept through the night for the first time in years, that they took a weekend trip with their grandchildren without anxiety, that they feel more energetic and hopeful than they have in a long time. You deserve a good night's sleep. You deserve to wake up rested and ready for your day. You deserve to not feel controlled by your bladder. And while I can't promise these exercises will completely solve the problem for everyone, I can promise that research suggests they may help. And that being consistent with them gives you the best possible chance of improvement. Your body is still capable of healing, of adapting, of getting stronger. You just need to give it the right support. So start tonight. Just those 3 simple things, and then keep going. Week after week. Give yourself at least 6 to 8 weeks to see how your body responds. And please, talk to your doctor. Show them this video if it's helpful. Ask if these exercises are appropriate for your specific situation. Work together with your healthcare team. If you found this information helpful, please subscribe to this channel. I share evidence-based health information for seniors every week, always with the goal of empowering you to take better care of yourself alongside your regular medical care. And if you know someone who's struggling with nighttime bathroom trips, share this video with them. Let's help more people get the sleep they deserve. Thank you for watching. Take care of yourself, and here's to better nights ahead.